Caulfield.
Thank you, Madam Deputy Speaker, and it's a pleasure to follow on from the honourable gentleman, the Chair of the Select Committee. And can I agree with everything he said in his last part of his speech? And it's a shame that his front bench hadn't taken a similar approach when the shadow Labour minister spoke, who I think spoke to close to 40 minutes and didn't come up with one solution or proposal about how we improve social care. I'm a great believer it's not what you do, it's the way that you do it. And in the same way, it's not how much you spend, it's how you spend it that makes the difference. And as someone whose constituency falls in the county of East Sussex, which has the highest number of 85-year-olds in the country, I can speak firsthand of the pressures on our social care system. But East Sussex, and I'm not saying to the Minister that East Sussex doesn't need more funding, because they definitely do, but East Sussex have set up their Better Together system, working hand in hand with the NHS. And last winter, they saw, by funneling their money into community care beds, working with the CCGs, despite an 11% increase in demand, they were able to reduce their delayed discharges by 33%. And the £2.5 million extra given to East Sussex by the government this winter went into the system, and we saw no delayed discharges, but we also didn't see those ambulances queuing up at the hospitals, closed A&Es. The system was able to cope even with an increased number of norovirus and flu outbreaks. And while we were subjected to urgent question after urgent question last year about hospital crisis and winter crisis, it's sad to see that with the system coping so well this winter, there hasn't been any acknowledgement of how hard NHS staff have worked this winter and how hard local council staffs have worked to see there being no winter crisis this year, despite the extra pressure. And that is because councils and the NHS are working much better together than they've ever done before. But what I would say is that we do need to be seeing what East Sussex is doing across the board. And while it is welcome that the department is now Health and Social Care Department, we are not seeing that joined up working at a national level. And what I am concerned about is if we don't see that across the board, that the £20 billion extra going into the NHS will be eaten up by the pressures on social care. Because if patients don't get the social care they need, their health will deteriorate. They will be admitted more often, they will be sicker when they are admitted, and they will be in for longer periods of time. Their discharges will be delayed, and their outcomes will be poorer. Not funding social care properly or not using that money wisely is a penny-wise and pound-foolish approach. And I hope when this session comes to the end and we have a new Queen's speech, that social care will be top of the agenda when it comes to addressing this. And for me, I would like to see three things. Firstly, the funding of it. And I'm sad that the amendment today in the Opposition Day debate wasn't chosen, because I too have a copy of the report of the Joint Select Committees, the long-term funding of adult social care. And I think the honourable member for Sheffield South East is quite right. Instead of the Green Paper, let's just get on with the recommendations in this report, because there is cross-party support for looking at a social care premium system like they have in Germany. Because we have to be honest with the British public, there will need to be funding for social care. And rather than people who've worked hard all their lives selling their homes, not realising that that's what they're going to have to do to pay for social care, or refusing social care until they absolutely reach a crisis point and then have to pay for it.
Will the Honourable Lady give way?
I will give way.
I thank the Honourable Lady. I mean, I invite her to agree with me that, notwithstanding the radical suggestion that she makes and my colleague, the Chairman of the Local Government Select Committee, makes about not bothering with the Green Paper, it would nevertheless be helpful if the Green Paper was actually announced as a date now, and not as a month or a season or even a festival, which is the latest one we've had, but actually a date.
I thank my honourable friend, and he is quite right. I am being slightly facetious in saying don't bring out the Green Paper, but if the Green Paper contained some of the recommendations of the Select Committee, it would be very welcome indeed. But we also do need a long-term funding solution. I know I've discussed this with the Minister before. The 4-year settlement for local government was really, really helpful. And if local government could have a 10-year settlement like the NHS has just had, they could do far more with their money, even if they weren't seeing the significant increases that they would particularly like. But my third request would be to look at the better use of our healthcare and social care professionals, because we have grown up with a historical medical model that's depended on doctors and GPs, and actually what people need is often a diverse range of professionals to help them. If you look at the East Sussex Better Together model, they just announced their community pharmacy programme, which is improving communications for patients discharged from hospital and helping them with their medication. The TCAM project, which is Transfer of Care Around Medications project, is enabling those patients at risk of delayed discharges or readmission to hospital to have a dedicated pharmacist to help them, because we know that problems with medication is one of the core reasons why people fail when they're discharged from hospital. They would help with access to the pharmacists have access to their medications. They'd be able to answer their questions, monitor side effects, issue repeat prescriptions, which often don't happen when someone's discharged home. And the research and evidence base showed that following that model will reduce admissions, will reduce length of stay, and give a better experience and outcomes for patients. 112 pharmacies in East Sussex are going to take part in this project, and it's a joint working venture between County Council and the CCGs. And I would encourage the Minister to look at rolling this out across the country, because moving away from being so dependent on GPs and doctors, and I'm conscious there's a number of doctors in the House this afternoon who do valuable work, but there are other healthcare professionals that we should be using as well. Because it's not just about the funding. And while the government has given £20 billion extra for the health service, while funding this year for local councils has increased by £1.3 billion, an increase of 2.8% compared to last year, has given extra money for winter funding. It's what you do with that money that makes the biggest difference. And we do need a long-term solution. We do need a specific funding settlement as recorded and recommended by the Select Committee. And we do need to make better use of some of the fantastic resources that we sometimes fail to recognise. We can do a lot more, even within the existing resources that we have. And so I am disappointed that the front bench didn't take the same tone as the chair of the Select Committee, because we can do more to improve the lives of our constituents.